Hi folks, this is Dr. Burke Mays with Pathways Integrative Health Center. I'm here today talking about a condition that I hear about quite commonly in my office, and I see quite a few patients with either this actual condition or have conditions that mimic it and look like it. So that we're going to talk about a condition called gastroparesis. And it's a diagnosis that's thrown out a lot to people who are dealing with digestive issues, and a lot of the time it's poorly supported. It's just kind of it's guessed at. So today we're going to talk about what it is, what causes it, and really most important of all, what can be done about it. Because in our office we blend functional medicine and functional neurology, and what we really look at is what is the underlying cause of a person's condition. Whether you walk in my door with back pain, neck pain, carpal tunnel syndrome, herniated disc, fibromyalgia, migraine headaches, whatever it might be, I'm more interested in what had that happen. Or as like a friend of mine once said to me, what the patient walks in the door with is not their problem, it's where their problems ended up. So we look deep into our patients' conditions to design a care plan specific to what they need, not as opposed to more of just a standard by-the-book approach, which often doesn't work. So gastroparesis, quite simply, is a delayed emptying of the stomach in the absence of some sort of obstruction. Now, a little bit about the basics about the stomach. A lot of us think that the stomach is where you absorb your food, and it's not. It's kind of really what happens is the stomach and the small intestine literally is outside your body. So it's analogous to having the fuel and the gas for your car sitting in the back seat lined up in gas cans. It's not the reality of it. What happens is your stomach prepares your food to be digested, and then get absorbed through the walls of your stomach into your bloodstream. So when you have conditions like gastroparesis, you get things like GERD. And by the way, a little bit about the anatomy of the stomach. The stomach is basically a big bag of muscle. At the top end is a very strong ring of muscle. The bottom end is a very strong ring of muscle. And it contains normally very strong, very potent stomach acid. Now, a little bit of a sidebar. Despite what the makers of the purple pill would have you believe, most people with heartburn and other digestive issues aren't suffering from too much stomach acid. They're having too little. What happens in your body when first of all, you need stomach acid. It prepares your food for digestion. It prepares certain things to be broken down. It's also the first line of your immune system where you kill off bad things. So you don't get food poisoning from things, or it kills off different bacteria and parasites. So if that stomach acid weakens, you're much more susceptible to different infections. What you do is you take water and turn it into very strong stomach acid. That's a very energy dependent process. So let's just say hypothetically somebody's not having the energy they need. And by the way, the main job of your metabolism is to turn your food, your fuel, into energy. So if you're having metabolic issues where you're not creating your energy efficiently, one of the first places it shows up is in digestion or brain function. More about that in a few minutes. So common symptoms of gastroparesis, things like acid reflux and GERD. If the muscles aren't being controlled, the stomach doesn't empty, things stay in your stomach, acids accumulate, they cause damage to the stomach wall, and you start to get that heartburn. Also, as that proper acid strength material leaves your stomach, it triggers the pancreas and the gallbladder to start your whole digestive process. You also get nausea. Well, if your stomach isn't emptying, food accumulates. One of the automatic responses is nausea. Your body's saying, get this out one way or another. We also can get things like weight loss. If you aren't digesting your food, you literally are malnourished. And then that leads to a whole bunch of other symptoms. All the issues of malnourishment. Get gassy, bloaty. If food stays in your stomach, it rots. It rots, makes gassy, bloaty stuff. And then you also get things like ulcers and stomach infections and upper small intestine infections. And this creates a whole host of kind of fairly unpleasant, potentially nasty conditions. So some of the biggest concerns with gastroparesis, one of them is it leads to malabsorption of nutrients. And again, your body, the job of your metabolism is to convert your nutrients into energy. And one of the highest energy consuming parts of your body is your brain. Your brain literally consumes, it makes about 10% of your body mass, 2% of your body mass, and consumes about 30% of your energy. So one little part burns a lot of energy. So when you're not making energy, one of the first areas shows up is brain decline. Things like neurodegeneration. That can be lots of different things, from depression to anxiety to brain fog to brain fatigue to movement disorders to seizure disorders to a wide range of conditions, all related to when your nervous system isn't getting the proper fuel. Muscle wasting. You need to absorb your proteins, get them into your bloodstream so they can be the building blocks to make your muscles. Osteoporosis. You need good nutrients for healthy bones. And lastly, fatigue. If your cells aren't getting the fuel to work, they start to slow down. That's what we call fatigue. And one thing to keep in mind is that there's two neurochemicals, one called dopamine, one called serotonin. Those are your feel-good chemistry. Those are the ones that drive your brain to feel good, and about 80% of that is made in your gut. So if we don't have good gut and GI function, that's going to affect the production of the chemicals that make your brain work. Shows up in neurological problems. In kids, it can be some of the spectrum disorders, ADD, ADHD, Asperger's, autism, can all be related to poor gut function and poor gut and gut inflammation. In adults, it shows up as things like memory loss, Alzheimer's, depression, anxiety, mood swings, OCD, vestibular disorders, movement disorders, seizure disorders. All these different conditions rely on a healthy brain. If it's not getting the proper nutrients, it doesn't work. Another area of big concern is the breakdown of the gut barrier. Your small intestine is really important. It keeps good things out of your body. Keeps bad things out of your body and let the good things in. And with gastroparesis, the pH, the ecology, and the health of the gut declines, and that barrier breaks down. We develop what we call leaky gut, or we call dysbiosis. Now it's kind of like having a house with holes in the screens. You got a house full of bugs, you run around trying to kill the bugs, but the reality is you need to go fix the screens. So we have breakdown in the gut-brain barrier. That can be a trigger to things like autoimmune conditions, where the immune system is reacting to large proteins that get into the bloodstream because they're passing through the holes in the screen. Now the immune system sees them as foreign, starts to attack those, and it gets confused and attacks your body tissues. And that can be the underlying cause for conditions like Hashimoto's thyroiditis, rheumatoid arthritis, Sjogren's syndrome, any condition where the immune system is attacking your body tissues. It can be a big part to food sensitivities. Say you have a leaky gut and you're eating a lot of a certain food, and those larger undigested proteins pass over into your bloodstream. Your immune system starts to react to them. Now you can start to react to things like wheat or corn or blueberries or strawberries or dairy or whatever those things might be. What I commonly see in my office is most food sensitivities and food allergies, if you can go back and clean up the gut and get the gut barrier restored, a lot of those allergies will clear up and go away. Lastly, this whole mechanism creates just systemic inflammation. We think about inflammation like if you sprain a joint, you get an inflamed joint. Well, this is inflammation of your entire body. We call meta-inflammation. That can affect your gut, it can affect your nerves, it stresses your immune system. And when you have an inflamed gut and brain are intimately connected, now your brain gets inflamed. Now we see the whole host of neurological disorders show up as a result of inflammation. In fact, what we're learning now is almost every health condition we're dealing with has inflammation as a major contributing component to it. So how is this diagnosed? Well, the standard way is what we call gastric emptying. It's a 4-hour test. You eat a certain volume of food, an hour later you should have about 90% retention, 2 hours about 60%, 4 hours out about 10% of it retained. That's normal. If that nervous system is slowing down, by the way, this whole stomach is under neurological control. If that's not getting that good control and it's not emptying, we keep stuff in our stomach for a longer period of time. And obviously, you got to rule out obstructions. That's either upper GI study with barium or endoscopy to rule out is there an obstruction. But most doctors will give the diagnosis of gastroparesis without doing this testing. They just look at the person's symptoms and say, bang, you have that. Now the good news is, if you walk in with improperly diagnosed gastroparesis, we can probably help you. Because once again, we're looking at the why everything's happening. but I always get a little suspicious if things don't respond. We want to rule out those obstructions if they're there. So causes. You can go two different ways. Basically, the gastroparesis is the result of the nerve to the stomach not working, and that can be coming from a couple different places. One is like a diabetic gastroparesis, which kind of gets lumped into a peripheral neuropathy. I don't see this one a whole lot. It's a little more complicated to work with. First, you got to deal with the diabetes, then you got to heal the nerves. The more common part we call the idiopathic gastroparesis. So the problem is in the central nervous system. It's up in the brain. And this is a part that's rarely looked at in the standard approach. We have a nerve called the vagus nerve. And the vagus nerve is the highway from your brain to your stomach and to your gut and to your heart and to your liver, to your kidneys and all those bodily organs. And it's also the highway from those organs back to the brain. It's a very busy nervous connection. And if that area is not working, it can be either poor nerve health or poor brain function. We start to see problems at both ends. So you can see things like if you have poor vagus function, you get issues like swallowing difficulties, stomach contractions, stomach cramps, or poor stomach acid production, or not a good adequate blood flow to the gut, or just the whole motility. Motility is the movement and the activity in the stomach and the whole intestinal system. If those aren't moving, things don't move through, and that's part of gastroparesis. Also, if that immune system, if the gut immune system is stressed from a chronic infection or a chronic bacterial issue or food sensitivity, that can create feedback slowing down that whole neurological reflex. So the medical solution is they try and stimulate it. One thing is like prokinetic drugs. Those are drugs that actually try and get the muscles to fire. It can be a drug called Reglan or erythromycin, also is known to stimulate gastric motility. They'll do antiemetic drugs, which those are anti-nausea medications. Sometimes they even inject Botox into this ring of muscle right here to paralyze it, to get it to relax and open up. Which, none of those ideas sound real good to me, especially that last one. What we look at in our office with blending functional neurology and functional medicines, we start looking for solutions. And one of the big ones is to examine the vagus nerve function. Simple tests, we look at palate. We look at a person's throat, have them say, ah. We want to see nice, even elevation of that palate. Or if you can see on this image here, one side's not elevating, and also the uvula, that little punching bag in the back of your throat, is getting pulled to one side. That strongly suggests poor vagus nerve function. We also look at gag reflex. If you either have too much of one or too little of one, that's indicative of vagus nerve function. And lastly, we listen to the stomach and the bowel. We should hear things move. There should be little gurgles and squeaks and bubbles and pops when we listen to somebody's tummy with a stethoscope. If we're not hearing that, that indicates things aren't moving. And then one of the solutions is stimulate the vagus nerve. If you go online, you look, you can find an article called the 32 ways to stimulate vagus nerve function. It's things like humming and gargling and lots of different little exercises to stimulate the vagus. And we have some other more effective ways here in the office, but that's a good document to get. It's 32 ways to stimulate vagus nerve function. Also, too, more importantly, to identify and remove gastric inflammation. Those things are helping shut that vagus nerve down. That can be looking at the food sensitivities, at the infections, looking at the leaky gut syndrome, and healing the gut, removing the sensitivities, healing the infections. And by the way, as I said earlier, with food sensitivities, what I see a lot is if you start to improve that gut function, a lot of the food sensitivities will clear up and go away. In fact, one thing we see in research now is the nature of a food sensitivity avoidance diet, like somebody's avoiding gluten or avoiding corn, almost 100% of the time leads to more food allergies and more sensitivities. So the smartest thing to do is if you identify a food you don't agree with, is get back and find out what's happening with the gut. Got to repair the damage created by the gastroparesis. We got to restore the nutritional imbalances. We got to heal ulcers. Often ulcers are there in the background. We need to heal the gut. We need to heal the ulcers. Deal with the dysbiosis, which is the balance of the good and bad bacteria. We always have goods. We always have bads, but we want to have them in a certain balance. And also deal with the nervous system impairments, helping the brain heal and helping the nervous system work. So that's a little bit about Gastroparesis, a little bit about what I do. If you're interested in learning more about what we can do in our office, feel free to reach out and contact us. Our website is Pathways Integrative Health. Office number is 763-634-5892, or you can reach me at drmays at askdrmays.com. Hopefully you can read that here on the screen. I offer, most commonly offer somebody who is dealing with something, a courtesy consultation. We'll spend a little bit of time together talking about if we might be able to help you with something. And then if we think we can, then we can move forwards and do other in-depth investigation. But kind of just a courtesy, get to know you, 10 to 15 minute conversation to see if we're a good fit to help you. Thanks for watching. Have a great day, and I look forward to hearing or seeing you soon. Thanks a lot.